Hi, Kavita. Hi, Jimena. Thank you very much for your message, and very good to have you with us. So, look, this is a lovely little collection of people. We're heading into the 1718s, which is great. This means we have a Core 8 webinar, which is wonderful. And I couldn't think of a more important discussion that we're going to have today. We are going to welcome two speakers to talk about different approaches to community mental health. And they're going to be speaking respectively of their experience working in and out of Rwanda and in Ghana. First of all, Samuel Habyarimana, is currently a PhD candidate in social work and social ecology at Loma Linda University in California, which is where he's speaking from at the moment. He has a focus on social welfare and social research. His doctoral research, under the guidance of Professor Suzanne Montgomery, PhD, explores the psychosocial factors influencing both survivors and perpetrators of the 1994 Rwandan genocide against the Tutsi, particularly examining how the community resiliency model, that's the model that I had the privilege of studying before Christmas, can enhance resilience and social cohesion. But that's not all about the man. He is also the founder and executive director of the Rwanda Resilience and Grounding Organization, www.rrgo.org. We'll put that into the chat in due course, or you could, Sam, if you like. Just put that link into the chat. Would you do that?
Yes, please.
Yeah. So he was recently honored as the 2023 Ambassador of the Year by the Trauma Resource Institute. And we are very privileged to have a very wonderful representation from the Trauma Resource Institute with us today, which is great. He's a certified teacher in community resilience, model skills, and also laughter yoga, which I must say sounds really attractive. And I was wondering whether I shouldn't come and do a course with you on laughter yoga, Sam, just as soon as you finish your PhD. So that's pretty much all I want to say about you, Sam. And Peter Badimak-Yaro, give a little wave, Peter, if you would, just so everybody can see you. Can you give a little wave? There you are. He's executive director of Basic Needs Ghana, a mental health and development advocacy organization that he's led for 15 years. He and I in the past have been warm friends and colleagues. We remain friends, of course, and I have the privilege of attending his board from time to time as an ad hoc member. He's a development worker with 2 decades experience and a leading mental health advocate in Ghana. He has worked on increasing access to community-based integrated mental health care services and influencing policies and practice, amongst other roles. Peter also advocates for implementation of the provisions of the mental health law of Ghana. He has a master's degree level academic qualifications in public mental health, international mental health policy and services, and community development. And his ambition is to see the poorest and most vulnerable live in dignity and be active members of their families and communities. So, without further ado, Elaine, because you're leaving us in a while, I'm going to invite Sam to speak first, so that you can hear him do that. And then Peter, I'll invite you to speak after, if that's okay with you. Sam, you've got about 10 minutes, if you don't mind, to give us your presentation. And I know that you are keen to get on with it, so welcome, and the floor is yours.
Thank you so much, Chris. Thank you so much for everyone who are here. My name is Samuel Habyarimana. I'm from Rwanda, and I'm executive director of Rwanda Resilience and the Grounding Organization. As well, I'm a PhD candidate at Loma Linda University at Behavioral Health.
Exactly.
It's an honor to talk about CREM, because I use CREM in Rwanda and I see how the CREM is changing my community. So it's my great pleasure to thank you, Chris, and the other Catalyst 2020 who have been inviting me. And as well, I thank for everyone who has been registered to attend this webinar, because without you, of course, we would not tell anyone. And by thanking you, I will do not jump without thanking Ellen Miller-Klasa from TRI, and Mike for innovating this model that I'm going to talk about, this model that has been contributing much in Rwanda. Without taking much time, I would like to share my slide and talk a little bit so that we can have time to discuss.
Thanks, Sam.
Can you see my slide?
Yes, I can.
Okay, so thank you so much again. I'm going to talk about community resilience model in responding to individual and community mental health issues in Rwanda. I'm not going to talk much about what community resilience model is itself, but I would like really, first of all, to talk about maybe the meaning of community resilience model. This community resilience model has been defined with different researchers, even who have been working on this model. Community resilience model is a skill-based awareness and prevention program that provide a biological non-stigmatizing and non-re-traumatizing perspective of a human reaction to stress and trauma. Importantly, this model help individual and community to aware the sensation of the stress and the sensation of well-being. And then this model, it's help to decrease as well as healing mental health problems, and it improve the what I can call the protective factors like increasing resiliency, reconciliation, and social cohesion. When I see these pictures that I'm sharing to you, I can come in my mind thinking how community resilience model is contributing in my community, not only genocide survivors, not only perpetrators, by different group of the people who have been trained this model in Rwanda. When we have been running this model, we started this organization, Rwanda Resilience and Grounding Organization, with the mission to respond to the effect of the genocide that's happening in Rwanda by using community-based intervention, first of all, which is adaptable. And even in the intervention, that can be scalable. That can be scalable and helping my community, my Rwandan community, not only hearing, but also giving them the way of recovering, bounce back, giving them the ability to bounce back from stress to mental well-being. So initially, when we started this community resilience model in Rwanda, we have been training the students and the community health workers. When we train the community health workers, we had the purpose that these community health workers can help this model can help them to heal their trauma as well as to support the people they regularly helping. And again, we continue to train CREM on genocide survivors. And then when we train this community resilience model on specifically genocide survivors, those people who survived the genocide, but still struggling with the effect of the genocide, specifically traumatizing, many different things. So this model has significantly decreasing the mental health problems, including depression. We write as well, we write the paper where we have been publishing the results of the impact of community resilience model on genocide survivors. Additionally, we also we use CREM to train the people like LGBTI community, the people who have mental health stress related to their status. And we get even good responding how the model has been adapting to them and help them to decrease the mental health related distress. And again, in the 2021, we piloting, we see how can CREM skill, because we have been seeing that this model, community resilience model, is helping the genocide survivors. And there is a problem between, there is even mental health problem and the psychosocial challenge among even the genocide survivors. We think, how can we use this intervention even among the perpetrators together with survivors? Because in Rwandan community, we live house by house with the genocide survivors and perpetrators. We're piloting this intervention in 2021. In 2023, we did a research of intervention. We give the intervention of community resilience model among the genocide survivors and perpetrators. Another thing is that before maybe I talk about the result for the research that we did, another thing that's always motivate me is to see how this intervention is scalable, is how this intervention is adaptable. Those are the resilience club survivors and perpetrators who have been trained the model in 2021, then 2021 and 2023, and then they make a groups where they meet regularly in their scheduled time, and then they sit in green in their local area, which is close to them, and they discussing how this model is helping them. And after, when you see this first picture, it's like a conviviality when they are finishing, when they finish meeting regularly, they make what is called the conviviality, and they invite us, they invite the LGO trainers to come. They say, oh, come and see where we are in resiliency, social cohesion, and reconciliation. So, and then we sing, we dance. This is the picture you are seeing. So I want to talk about a little bit about these results. We rigorously, hypothetically say, let's evaluate the impact of this intervention among genocide survivors and the perpetrators. We have the mental health symptoms like depression, emotional regulation, PTSD, and anger. And we have as well the resiliency, compassion, and the social cohesion. Interestingly and surprisingly is that in both groups, because we compare the survivors and the perpetrators, as you see in the table, both groups, survivors and perpetrators, this community resilience model help them to decrease mental health symptoms in post-intervention, immediate intervention, and after 6 months, the same as perpetrators and the survivors. And again, even those variables for protecting factors like resilience and the compassion and the social cohesion, compassion in the social cohesion has increasing highly, and the resilience has been increasing, even though it was not, when you see on the chart, it was not increasing at the same level with the compassion and the social cohesion. And maybe there is many different factors because the resilience, it's not immediately changing with, it changes over time. So, and then we have some witnesses, the testimonies of the survivors, testimonies of perpetrators who are trying to show how and what is the impact of this intervention in the Rwandan community. For instance, here, the survivor said, before this training, I used to say that I will never meet and speak with those who killed us, perpetrators. She was saying in public when there's a survivors and perpetrators together. But after attending CREM trainings and joining the Resilience Club, I feel the burden that was away on my shoulder has been lifted. Now we participate together on ceremony that prepared each other in each side, which is interesting. Even the perpetrators, there was many witnesses, but we choose even this, the perpetrator said, attending these CREM skill, in Rwanda, another things maybe that I can add, in Rwanda, because the majority of these people are not knowing, are illiterate, their level of education is still low. What we did, we sit with them and they try to conceptualize, to adapt community resilience model in our Rwandan context, and they call Inzira y'Umutuzo. It's a way of resilience. This is how it is called in Kenya, Rwanda. So for them, they say, oh, when I come in Inzira y'Umutuzo, which is CREM skills, came like it's like a light in darkness. I met survivors during the training, and you have been helping each other since then. I sleep, I feel like I am important in the community, because most perpetrators, for them, when they come from jail, they start to hiding, not to go in public, but participating in crime training skills intervention, it kind of giving them feel like they are human being again, because they start interacting with the survivors and their mental health problem has been decreased. To finish, we are moving forward. This community resiliency model in Rwanda, majority of the people whom we are training, survivors and perpetrators, are the people who are more than 50, who are older. We are planning to have this intervention to go to the people who are young adults, so that we can continue to help to build resilience in Rwanda. Thank you.
Sam, thank you very much indeed. What fabulous work. And I loved that phrase, evoking light coming from darkness. And what an amazing story to have that terrible genocide, and then for the people to be imprisoned eventually, and then for them to come back out of prison in due course after their punishment was served, and then of course going back to their communities, because what not all of us understand is that Rwanda is quite a small country, unlike other African countries which are huge geographically. And so of course the people are going to go back to the very places where they lived, and therefore they're going to go sometimes to the very place where they committed the genocide in the first place. So you are working in a very interesting way with a very interesting model, and it's fabulous to see how this community work is going on. Now, Avani, thank you once again, Sam. Avani, I'm just going to invite you to introduce yourself quickly. This is Avani Parek, and she is one of our Catalyst colleagues. Don't forget, we are the Catalyst 2030 Mental Health Collaboration. Avani is just wanted to say hello and introduce herself, and then we'll go to Peter.
Hi, everybody. My name is Avani Parek. I'm based in Bangalore, India. I'm happy to be joining the Catalyst team. You all might have met my colleagues on the collaboration side, Lana and Mishri. So I'm going to be joining those folks. And just wanted to say personally, mental health has been like really, really key to my journey in life. I've done some counseling work in the past. I've worked in sexual and reproductive health. And so it feels like coming full circle. It feels like coming home to see this collaboration so vibrant and robust. So thanks for having me. And I hope to see more of y'all and to support this collaboration in all of its goals. Thanks so much.
That's great. Avani, put your professional email into the chat. That would be helpful so people can be in touch with you. That would be great. Now we turn to Peter. Peter, thank you so much for agreeing to come on and to make your presentation. We are really happy that you've joined us. As I said, you are the Executive Director of Basic Needs Ghana. And I wonder whether we can ask you, Susan, to put up the presentation for Peter, and then Peter, I'm sure you can then jump in. You may have noticed, Peter, that you have a colleague here in Rosemary. She is Basic Needs, Basic Rights Kenya. And Rosemary, you're very, very, very welcome. Lovely to see you. And it's lovely to see some of the other people who have their videos off. Manoj, lovely to have you here with us. And so here we are. Over to you, Peter, and welcome. Please take 10, 15 minutes to do your presentation.
Thank you very much, Chris. And coordinators of Catalyst team, mental health group, and to all the distinguished attendees. Hello, Rosemary of Basic Needs, Basic Rights Kenya, a close colleague. And I also have a number of my colleagues within the team here in Ghana in attendance. So hello to them. This is a presentation I'm doing on behalf of them all. And to say how privileged we feel to have been invited to share in this platform. And let me extend to Samuel hearty thanks and congratulations for setting the scene and giving us a good picture of how post-genocide Rwanda initiatives are helping build resilience and they need a cohesion to bring about peace and development. In Ghana, we are slightly different in that sense, but the issues of mental health or mental illness, mental disorders, whichever we want to discuss them, vulnerability, disadvantage, and exclusion because of the illness someone experiences, particularly a mental health condition, are about the same. And so people tend to experience individual repercussions of personal wars, of neglect, exclusion, discrimination, and stigma. And as a result, they require the same levels of support as anyone else who was able to live and work successfully in his community. Can we go to the next slide? And Chris, I also wanted to say that we cannot speak about basic needs without mentioning you. And I believe Rosemary would agree with me that basic needs has become a global community of practice. And what we do in Ghana is just one part of a big initiative that has transformed millions across the globe by the visionary leadership and ideas of Chris Underhill, who is coordinating this. And so our purpose has not changed as such, in the sense that our purpose is to enable people with mental illness and let me dare say epilepsy live and work successfully in their communities. And to do this has been the very innovative, user-led and centered model for mental health and development, which has been tried and tested in various contexts and have been found to be just right because it's very adaptable. A key part of it, in addition to providing clinical services, is socioeconomic rehabilitation and strengthening capacity for one to live positively with his condition and being able to speak up and be a model for himself or herself and the community. And so working with people to access treatment services, but in addition to treatment services is addressing the socioeconomic challenges that impact on their well-being. And so livelihoods are a key part of what we do. And this talk I'm focusing on is on one of our initiatives that was funded by the UNDP with funding from the European Union under the Climate Innovation Accelerator, where the support is to help people who have lived experience of mental illness with reduced symptoms of their conditions to move on to get themselves becoming productive and being economically empowered to themselves and their communities by being productive and earning an income. But a key part of it, which I thought I should highlight, is the climate resilience part of it, that all the socioeconomic activities which are agro-based would contribute to improving the environment, would instill in beneficiaries farming practices that contribute to conserving soil and water, and for that matter, the environment, the ecosystem as a whole. And so, next slide, the project focuses on enhancing vegetable production, small ruminant farming for people who have experienced mental illness with significant reduction in symptoms, but also who are vulnerable widows and female-headed households, and because of that have become single mothers. And it's also focusing on areas where soils have been depleted and farming is becoming more of a drudgery than one that brings about joy and harvest. So to enhance the soil fertility through organic farming and using nearby water sources for all year-round cultivation. And much as it's an 18-month project, it is helping to enhance competencies around organic manure production and integrated pest management using agro materials such as neem seeds, products, and other vegetable or herbicides, more or less, that can be produced from that. And the focus is on dry season gardening that can also help produce vegetables that would earn an income as well as promote food and nutrition within the household. And we've done this to support some 200 mainly women, individuals, female households in these 6 communities. And going through the training alongside ensuring that they are getting their regular supply of medications and appointments with psychiatrists or mental health service providers at the community level. They engage in these activities. And I thought I should share with you the story, next slide, of Memunatu. Can I have the next slide?
Yeah,
Memunatu is a single mother of about 4 children, 39 years old, was diagnosed with depression and anxiety. And because of that, was really isolated from the family. So even though not banished or destitute, was more or less living entirely by herself on her own within the family setting. Nobody bothered to care, nobody bothered to ask. And it has all been down to the triple burden that women go through, being women or female, having the mental illness, and are poor without a husband or a male benefactor, more or less, to support. And through the work Basic Needs has done with the support of volunteers and community health workers, managed to diagnose her condition, and she was put on some treatment alongside joining a self-help support group that allowed her have more people around her, have a place to go and socialize, to sing and dance. And I think I heard Samuel talk about conviviality. Of course, that also helped to bring about a sense of comradeship, a sense of friendliness, because she also encountered fellow women with similar experiences. And it is really quite heartwarming that she was one of the first people to raise up her hand to speak in a visit of funders to ask who feels that this has been a game changer for you in this initiative, short as it may. And her words are those that we have captured here. I now feel fully recognized and respected by my family and neighbors. And the quality of food has improved, and my children are better fed. And more so, she has not forgotten about the effect of social gatherings and being financially capable, being sure of earning an income that can help her meet not just household day-to-day expenses, but meet her monthly refill of medications or to travel elsewhere. And so within the space of time allowed me and my colleagues that I'm doing this on their behalf, we have found that, and I believe all of us in this platform know that managing mental health conditions or achieving resilience and well-being goes beyond just medicines or clinical interventions. The psychosocial aspects, the non-therapeutic aspects of these really contribute to building the needed resilience, helping people get included. And so immersing within the community, having come out of an illness, is not very difficult to integrate compared to taking somebody off to an institution, such as a psychiatric facility, to be treated, and one day told, you are fine, we are discharging you. And I think that is the singular, unique thing that the model for mental health and development that we have worked with over the years has been able to establish, that community-based support with treatment services and a means to a livelihood, being productive, goes a long way to help address not just the ill health condition, but the sociocultural networks that somebody can maximize to enhance his well-being and overall resilience. And so let me stop here, since we still have some time for interactions, and I can fill in any areas of clarifications needed. And thanks again to you, Chris, and all the coordinating team of Catalyst Mental Health Group, and all the listeners that have made time to be part of this interaction. I guess we can also learn from you. Thank you very much.
Thank you, Peter, very much indeed. I think we will close off the presentation now, and then we can come back to full screen. Thank you very much, Susan. So what an amazing couple of talks we've had. I really deep experience working in very, very complex issues. And it occurred to me that both speakers were, in a sense, talking about working with people who needed to be recognized and who had perhaps not been recognized up until that point, or not sufficiently. In the case of Sam, of course, both the people who had become victims of the genocide and those, of course, who were, interestingly, those who were perpetrators but seeking restitution. And I think that that was one example. And then, of course, Manatu, who you just talked about, Peter, and how she said that she felt recognized now, so important. So it would be wonderful to have some questions, and I see that there are some coming up on the chat. Michael Gilligan, welcome to you. It's lovely to have you on the webinar. Do you want to just very briefly introduce your questions? It's been nice to have some other voices on the panel. If you'd like to unmute, that would be great. Over to you for your questions to Samuel.
All right. Thank you, Chris, and thank you all for organizing this session. And I join with Peter in thanking everyone for their participation. So my question, Samuel, and this is due to my lack of knowledge of the sector primarily, but I'm interested in what was the sample size of your study and how you encouraged participants in this study. And so that delves into my second question, which is it's fascinating to me that you were able to engage both survivors and perpetrators. And how did the process evolve so that you were able to work with both groups? And were the cohorts separate, or was there collaboration or mutual engagement? So that would I think that closes off my line of inquiry. Thank you.
Sam, do you want to jump in?
Yes. Thank you so much. I first want to recognize Dr. Montgomery, Dean of Interdisciplinary Studies at Loma Linda University, who is here. Thank you for joining this webinar.
Absolutely.
So this question, yes, thank you for asking this question. The sample size in my study is 150, whereby we have 75 survivors and 75 perpetrators. So you ask, are those people, all of them have been training in the same room? With the purpose of this research, we ask that question because we wanted to evaluate whether being trained CREM together, survivors and perpetrators, or survivors alone, if it does help for them to improve their mental well-being by decreasing mental health and improve resilience and social cohesion. What we did, in those 150 people, we have a group of 50, both survivors and perpetrators together in the same room. We have another group of 50 only survivors for CREM training alone, and we have another 50 only perpetrators on CREM training alone. So then we comparatively evaluate the impact of CREM trainings on those groups. The result, as I was mentioning, it has significantly improving in all groups, which was proving having survivors and perpetrators in the same room to train them CREM. It's very important because it helps them to improve their mental well-being by decreasing mental health symptoms and increasing those protective factors, which is resiliency, social cohesion, and compassion. Maybe another question he asked, how we get them? Because in Rwanda, as Chris said, maybe some people who don't know more about Rwanda, the survivors and the perpetrators, normally the genocide happened in Rwanda in 1994. The genocide survivors and the perpetrators were the family members. Some are neighbors, our in-laws. So when the perpetrators back in a community, they don't have other choice. Even survivors doesn't have other choice unless they come because they finish their sentence. They need to come back to live together. So having them, we're working close with the local leaders, and then we know them, we know those who finish their sentence, and then we request them before they attend the training. For instance, that group for Together Survivors and Perpetrators, we ask them if they are willing to participate in the training where they will meet with the survivors and perpetrators, because we will make sure they know about that they are going to have the training together. So that's how our result was proving the improvement of well-being through community resilience model intervention.
Thank you, Sam. Thank you, Sam, very much. Rosemary, you put a very interesting comment in the chat there. Would you just like to open the discussion a bit with Peter about that intersection, climate, resilience, and well-being? That would be very helpful. You're on mute. And welcome, by the way.
Thank you very much. It's one of our first attempts to demonstrate that. I think even without going to scientific evidence, what we see every day in Ghana are increasing harsh weather and climatic conditions. Our rains are becoming shorter, and when they come in torrents with floods. They wipe out farmlands, or they just allow crops to wilt during periods of drought, which is becoming perennial thing. So, our part of the world being predominantly agrarian, mostly peasant farmers, smallholder farmers, this is a very serious drain on their resources. Whatever is used to plant, you may not harvest anything at all. You have no savings in the bank, and you become food insecure because you will not be able to feed yourselves with harvest from your farm till the next rainy season. And even now, with GMOs, genetically modified seeds, people don't have seeds for the next planting season. They would have to buy. And this is just an example of how much is impacting on people. And considering people who have lived with a mental health condition and have probably spent all that they've had seeking treatment, become economically drained and with no assurance of their farmlands and whatever means they have, animals as types of savings or insurance helping them out. So they need to go back to practices that can help build some resilience using organic materials, including ways to conserve floods and water and maximize available water for a sustainable period of the time of the year to grow crops, was that attempt for us to do that. We can go into the aesthetics and the soothing nature of vegetation or forests or trees or flowers or plants to the well-being of an individual who is working with plants that are growing nicely with good flowers, and the rest is also all there. So that is how we couch this, purely from contributing to conserve the environment, but also promoting production that can help improve income and food security. Over.
Thank you very much indeed for that. Rosemary, just jump in if you would with your observations of the situation as you find it in Kenya now, because you've recently had very serious floods, for example.
Yes, thank you, Chris, and greetings, everyone. Peter, I can totally relate to your project, and I really like how you've crafted it. I'll definitely be in touch after this, because we're just coming out of floods. Like you said, the rains, we never know when exactly will the rains come, and when they come, it's torrential. And now again, we are back to people picking up the pieces and thinking, what do they do for the next season? Because this season is lost for for very many people. So I liked how you brought out that it even just when people can work with vegetation and how it promotes their well-being. And I liked how you've crafted that project, very practical. I can say I can work also in Kenya, and much needed, and many parts of Africa, I think. Thank you.
Thanks, Rosemary. One of the important things about the mental health collaboration of Catalyst 2030 is this practical exchange. And so one of the things that I really appreciate about this webinar, for example, and thank you, Joel Malharan, for your comments, very much appreciated. One of the things that I very much appreciate about the way we work is that we share practice. One of our younger participants, Wycliffe, is on the program at the moment. Hi, Cliff, lovely to see you. and you're just starting your organization now, and I know that you're very interested in the models that have been shared. Do you want to just give us a wave and say hi?
Hi, everyone.
Really nice to see you, Cliff.
Thank you, Chris, for this opportunity, and I'm really great. I feel good to be here and just to hear more about mental health and what other people are doing in other parts of the world. So it really gives me great elation, and I feel so much at home, and I just want to listen and hear everyone sharing more and more. So thank you so much for being here.
Thank you, Cliff. It's lovely to have you with us, and you are doing wonderful work with young people.
Thank you,
We
Chris.
hope to be able to support you more. That would be great.
Thank
Matty, Simon, can you hear me? I'd love you, Matty, just to tell us briefly about the international conference that's coming up soon. Can you hear me there? Matty, Simon? I know that she's there with the video closed. She's probably off making a cup of tea right now. That happens. We'll come back to you in a minute, but thank you very much. Matty, if you do hear this, do please come on. That would be great, because I want you to introduce the Glasswing conference that's coming up, Glasswing and Catalyst conference, which is coming up soon. So, let's get back to the presentations. We've got a few minutes left. Sam, let me come to you if I may. Where do you think your work is going to go next? Because obviously you have laid out the work to a certain extent. You're still busy with your PhD right now, but that will come to an end in due course, and you'll be able, with the help of your colleagues from Loma Linda University, including Dr. Montgomery, we obviously know that that will come to an end, and you'll hopefully walk away with a wonderful PhD. But what I want to know is what's going to happen then? What are you going to do with your work in Rwanda? How will it develop after that? What's your vision?
Thank you, Chris. Thank you for asking that question. My vision is to continue helping my community and extending this intervention not only for those who directly faced by the genocide, I mean survivors and perpetrators, but also the first generation, the descendants of survivors and perpetrators, because the research are proving that there is intergenerational trauma for the children who raised by survivors and the children who raised by perpetrators. I think there is a much need for those community to have a community resilience model. Not only that, I am visioning that like other countries that are in East Africa or in Africa that has been experiencing the civil war genocide, like in the Congo, like in Central Africa, like so that they can South Sudan, they can have that intervention, because within the research for CREM, it is proving that this intervention, it is carrying in many different places, like in Sierra Leone, in Angola, in whatever, so that the people can have at least something that can help them to overcome to mental health problems. Thank you.
That's great. Well, obviously everybody wishes you luck in that, naturally. Matty has kindly said that she will get to a safe place. I think she's on the road at the moment, but she's going to get to a safe place to make her comment for us. Matty, are you there? Can you do that now?
Yes, I'm here. I apologize for that. Hello, everyone, and thank you so much, Peter and Samuel, for this conversation. It's really been amazing and exciting to see you two in action, especially ahead of time for our conference as well. And we're excited to welcome you both at our conference. So thank you, Chris, for the space. I would like, on behalf of Glasswing, to invite everyone here to our annual mental health conference, which is co-hosted in collaboration with the Catalyst Mental Health Collaboration with Chris and USAID. I will put the registration info in the chat box right now, the registration link, so that everyone has access to it.
Great.
And please feel free to share with among your networks, and you will see this posted all over our LinkedIn's, and we hope to see you all there. Peter and Samuel will also be joining us as speakers on a panel on scaling community mental health programs and the challenges and the barriers that arise in that. So it will be a similar but very dynamic conversation. So we hope that you are all there. And our agenda will be posted shortly as well on the Zoom events page. Thank
That's
you so
great.
much, Chris.
Thank you, Matty. It's lovely to hear your voice, and thank you for taking the time and making it a safe announcement, not just shouting down the phone as you're driving along. That's very good. We appreciate that very much indeed. Now, let me just think where we've got to. So we've got just a few minutes left, and we are, I think, very much involved in a very interesting conversation. I wonder whether Dr. Montgomery, you would like to just develop a little the comment that you had made in the chat, whereby you talked about the two models having some kind of relationship to each other. That would be really interesting to help. And welcome, Dr. Montgomery. Very nice to see you here with us.
Thank you so much for this wonderful platform to have this engagement. Yes, I actually, ironically, Sam has been involved with another group of climate change interested parties and implemented a climate change assessment in Rwanda, and actually is seeking to now, through engagement in activities that are promoting wellness, very much like the colleague from Kenya did, adding CRIM in as well, because CRIM looks for resources, and being actively involved in creating your own, taking charge of your own destiny by planting, by growing weeds, by being independent, that is a resource. So adding these things together, I think, would extend the benefit that already occurs by simply engaging in the activities. And I know that Sam is currently exploring this with colleagues from Michigan and other places, actually doing the combination of both, and I can't wait to see that happen. I also have to give sort of a quick shout out, because it's not easy to engage survivors and perpetrators in Rwanda, and they are one of the groups most affected by food insecurity. So offering them something tangential, I'd never thought about that until I was part of this group, offering them something tangential where we actually did both activities together would address another huge need they expressed, because he also conducted a very detailed qualitative needs assessment. And that, of course, was one of the major issues, the current food insecurity and the current political and economic climate that really disadvantages them. So it further impacts their mental health status. So thank you for your question.
No, it's great. Lovely to see you, Suzanne, and thank you so much for being with us. One of the things that both Peter and Rosemary will recall is the fact that we have used the livelihoods module of the basic needs model for many years now, and it actually does really play an important role in the sustainability, literally speaking, of the individuals in question, and also the what you might call the therapeutic benefit arising out of being in a group and working together, and all of those different things which are so attractive, I think, about that particular work which we do. We have Lubna. Do you want to jump in?
Oh, thank you. I'm so grateful to be here, and thank you for the space you create, and the energies that you bring here together. It's I'm very grateful to be here. Thank you, and thank you all for the work you're doing. I just wanted to, I love the bringing the sides together, because we can only lead with understanding, acceptance of what is and where we all come from, but coming together in understanding, compassion, and forgiveness, and ourselves and each other, and then lead with compassion so that we can change the future. And so I'm grateful for the work you're doing. I wanted to share that it's about the Living Labs and an update. We talked about, the last time I came and talked about a session where we were talking about AI and AI ethics and empathy. So now during CCW, we had I brought people from ethical AI standards from ITU, ISO, and IEEE to talk about the role of standards in human rights and ethics. And then also a collaboration talked in a follow-on session on using games for change and game mechanics. And so behavioral science and mental health obviously is at the core of it, and to affect the change in a fun, safe, and empathic, applying the technology and our compassions and our capacities together. So I wanted to invite everybody to have hopefully can have another time to talk more about the collaboration. And I hope we can bring our contributions together. We've been working with other members of Catalyst and other social innovators and civil societies and small NGOs on the ground in several countries in Africa, and it's not limited, but around setting up the labs where they come together in collaboration rather than in competition for grant applications, that together they can have echo their voices.
Sure.
And cross-pollinate. So I'm inviting to add to the pot, and it's an alliance. It's not an organization or anything. It's more about self-organizing around aligning, harmonizing, taking it from noise to a jam to a symphony. Thank you for the space.
Thank you.
Thank you.
Lubna, put your email if you would like it. Put your email into the chat. And,
I have, and I'm grateful, and I hope we can speak some more. Thank you.
That's great.
Thank you so much.
Very much. Thank you. Thank you. We're pretty much out of time now. Gabriella, are you there? For some reason, a lot of our people today are hurtling along in different sorts of vehicle. Can you hear me, Gabriella, right now? If you can't, don't worry. That's fine. That's absolutely fine. So look, I wanted to thank you, Peter. Thank you so much for being with us and for sharing your ideas and for sharing the case study, which I think was so valuable in understanding how livelihoods and that work fits into the rest of the modeling that you were talking about. Really appreciate that. Sam, thank you so much for your contribution. We look forward to both of you being coming to more collaboration meetings and to making your contribution as ever. This mental health collaboration is going from strength to strength. We have recently been approached by Ashoka fellows who are mental health specialists. They are recognized by Ashoka, and they have had a group running for some time, and they have asked whether they can dissolve their group and come to us, to our mental health collaboration. And so I am also an Ashoka fellow, so I said that I would look after them and treat them gently as they came to join us, and so they may well come and join us next time. Hada Al-Zain, thank you very much indeed. And I just want to give you the date for the next webinar. Susan, where are you? Can you just tell us that? I hope I don't throw you by asking you that question. If I do throw you, it's June. It's in June. I think it's in the second week. Am I right? I think it is June the 12th. Does that sound right?
I think so. Just give me a second though.
I think it's right. Yeah, I think it's okay. Yeah, June the 12th at 4 o'clock British Summer Time. that would be great. And of course, we'll be in touch with you with the link and all the rest of it as we normally do. If you're not a member of the Mental Health Collaboration already, do please write to me or Susan, and we can help you to become a member easily enough. It just remains for me to say thank you so much for being with us and wishing you a wonderful continuation of your day. Sam and Peter, thank you very much. Take care.
Thank you for having me.
Bye. Thank you.
Thank you. Take care.
Thank you.
Take care, Sashi.
Thank you. Yeah, you too.